I'm here with
Leistikow from the Netherlands.
Excellent. We're going to be talking about safety in this little conversation. So we've taken to the safety of a sofa to protect us. So,
yes.
As I understand it, you're one of the people who've been behind programming the safety stream of this 3-day conference. It's in the title of the conference, so safety seems to be very important. But I'm imagining safety is a lot more than don't let bad things happen.
Absolutely, Mark. So I've been privileged to work together with Aidan Fowler of NHS England and Carol Munt, who's a patient user representative, to put together a safety program for the forum. So a stream basically means you have a session at each time slot in the program. So if you would want, you could go to the forum and just follow all the safety stream sessions, as you could for population health or other streams.
So what are the big themes in safety this year? Because it might just be me, but I feel like we're kind of entering or currently in a period where the world, for many people, feels a lot less safe.
Yeah, so for safety in health and care specifically, we've been, and we meaning the healthcare sector, has done a lot of work the previous decennia in improving safety. We've included some learning from outside of healthcare, like from aviation, using root cause analysis. But we are seeing a kind of decline in the improvement. So safety is okay, but it's kind of plateauing and it's not getting better. And we feel that could be due to the way we look at safety. So what we really try to do at this forum is to include other ways of looking at safety than you would find in the previous forums maybe.
It's interesting. So in a kind of day-to-day practice thing, I'm guessing that's a step beyond compliance as a culture in health and care organisations.
Yeah, that's an excellent point, Mark, because one of the myths is that if everybody would just follow the rules, all would be well. And that translates to when stuff goes wrong, people look at which rules weren't followed or which rules weren't there, and could we create new rules. And sure, I mean, rules have function. I mean, it's good that you all drive on the left side of the road, even though I'm used to driving on the right side of the road, but you decide on which side of the road you're going to drive and everybody sticks to it. Yeah. It prevents head-on collisions, so there are very useful rules. But in the complexity of daily healthcare provision, the healthcare professionals, together with the people they serve, the users, the patients, have to constantly tweak what is the right care for this patient in these circumstances. And they need to feel some form of space to not abide to the rules if they think the rules would not be in the best interest of the patient. But that's sometimes a mindset shift. It's a mindset shift for the healthcare professionals because they've been learned to abide to the rules. It's a mindset shift for their supervisors who might not understand the specific context, but also for the government or for regulators, like in my role, I work for a governmental regulator in the Netherlands. That we shouldn't just be looking at which rules weren't followed, but we should try to understand the context in which a healthcare professional did what she or he did with the best intentions in mind, and try to understand how we can create a better environment in which that a healthcare professional can thrive in providing the right kind of care for the patients. And that's sometimes something outside of the sphere of, how do you say it? That's something that the healthcare professional might not be able to influence themselves, but it's more organizational or more nationwide or governmental.
So a very strong theme of this year's conference is discussions about equity, health equity, making sure that historic patterns of people getting bad care aren't repeated. Do you think there's an interaction between kind of safety and equity and inequality?
Oh, absolutely. And it has, for example, to do with something which is a bit of a difficult word, but epistemic injustice. So understanding that if somebody tells you something and you don't understand what they're saying, that doesn't mean that it's not worthwhile what they're saying. Or understanding that there are some biases that you have for certain groups that you might disqualify what they're saying just because they're part of a group. For example, a person with dementia or a child. So these, I think, have a huge influence on inequity because certain groups are prone to experience epistemic injustice quicker than other groups will be. And this is something we should be addressing, and we are addressing also in the safety. But then also, if I may add, things like restorative justice. So when things do go wrong, so we expect our healthcare providers to function in pretty dire circumstances sometimes. And in a sector where you know that even if normal people do their normal work in a normal way, stuff can still go wrong dramatically. So when it does go wrong, we need to be there for the patient and next of kin, of course, but also for the healthcare professional. And that is also something, I don't know if it fits in equity, but you have to find a just way of relating to the people who you are asking to do this very difficult job and be there for them when stuff goes wrong.
Yeah, it sounds like there's a kind of spectre haunting the whole discussion around transparency, because transparency is extremely important for some people, but for other people transparency can feel like a threat, a kind of working under a microscope. It feels like there's a tension there.
Yeah, it's weird, right? Because professional sports people, they're used to transparency. I mean, they're filmed. It's on television. It's in the replay with focused on and etc. So people in other sectors who exceed in what they do, are really good at what they do, are very used to other people, lay people, looking over the shoulders and commentating what they're doing. So the football supporters. But in healthcare, that's difficult. At least it depends. I mean, I think pediatricians are more used to it, and elderly care physicians are more used to it because they're used to the family being there and co-deciding what's happening with the patient or the user. But for the rest of healthcare, I think it could definitely help if that transparency is also put in the right context. So if, for example, you would only make transparent how many people die per cardiac surgeon, and the story would be the more deaths for a cardiac surgeon, the worse the cardiac surgeon is, that would be very detrimental to quality of care, because maybe that cardiac surgeon that has the highest death rate is actually the one performing the most complex operations. And people send their patients to him or her because he or she is really good at it, but because the input, so the patient, the health status of the patient is lower at the beginning, the output is probably also worse. So if you make that transparent, and then that cardiac surgeon will say, okay, I'll stop seeing these patients, then the whole group of patients will not be operated on at all. So it's a dilemma. The transparency needs to be put into the right context, and that's sometimes very difficult for lay people to understand. But it's our job, I think, as healthcare to make it clear. But that's, I think, one of the reasons why this is more difficult than for professional sports.
Yeah, because everyone's got an opinion about a professional sports person, but the professional sports person isn't going to influence whether your relative lives or dies.
Yes.
But one of the subheadings of this conference is regenerating healthcare together.
Yeah.
And it feels like, I've been asking all my other interviewees about this, it feels like there's an admission that something has been damaged or lost or is ailing. Is it the pandemic? Is it broader currents in society? Like, in safety, what is it we might need to be regenerating together?
Yeah, so it's on different levels. Depending on which country you live, your government gives more or less attention to quality of care, to healthcare, and depending what country you live, government might put more interest in preventing that people need care at all, or they could only put attention on the when it's actually too late when you need care, to make sure that when you get care, you get the right care. We see an enormous outflow of healthcare professionals leaving their jobs. COVID was part of the problem, but it already started before COVID. So people in healthcare experiencing what we call moral distress. They cannot provide the quality of care that they want to provide, that they feel is morally their responsibility when they are a healthcare professional. And changing that is often beyond their own circle of influence. So that's more on the influence level of the board of the organization, or maybe the region or the government. And this is about the together thing. So basically, if you really boil it down, I think, my opinion, that healthcare is the epic battle of humanity against nature. It's the epic battle of preventing harm, preventing pain, preventing illness and sickness and disease, and preventing death. And we've been really good at this the past 300-400 years, getting better at it and understanding it, but it is an epic battle of humanity in itself. And it is now often framed as something that healthcare providers should be doing. And here's a bit of money and you fix the problem for us. And that kind of excludes, I think, the idea that it's a societal issue. So in society, if we make fish and chips cheaper than fruit and vegetables, if we accept high smoking rates in certain parts of our communities, if we accept bad schooling, bad housing, and then people come to healthcare with all these health problems which are actually caused by societal choices, then it's, in Dutch we say, dweilen met de kraan open, which means you're trying to mop away the water while the tap is still on. Yeah. That's what's happening. So if we really want to improve care for the people who need it, we should see it as a societal challenge and not just one loaded on the shoulders of healthcare professionals who are really trying their best but muddling through.
So final question, it's a difficult one. Given that you painted a picture that really safety lies not just in a ward or a clinic, it lies in much broader determinants and stuff like that. What can any of us do in our domain, whatever that domain is, to kind of influence how these things turn out? Because you have a kind of political domain, you have a personal domain, you have the domain of personal choices. Not asking you to solve all of the problems, because we've only got a minute, but if you've got anything you can kind of help people at home to kind of think about.
Yeah, so maybe it's, I don't know, it's a difficult question. So, and there's multiple answers you could give. Regarding health, I think it's important to realize that some of your behavior is a choice. And you can choose to smoke, you can choose to drink. I mean, if you're not addicted to it, it's a choice. Yeah. And it can be fun. I mean, that's not the point, but it is something which has effect on your health status. And so the things we do, if we choose to accept that if somebody makes a mistake, that they are penalized, instead of that we look at the broader picture of what are the circumstances in which this mistake could occur. If we choose to say, you come to the doctor and say, you fix my health problem, and I'm not going to take any responsibility for it myself. Or if you say, I'm pregnant, but I'm not going to, or I'm not going to vaccinate my children, for example, which is an issue of public debate. I mean, you can choose not to vaccinate your children, but then you should realize that that choice has consequences. And your child might get very sick or die. And it puzzles me that many people have certain behavior they choose, and then they don't accept the consequences. So vaccination, for example, I know this is a topic which people feel very strongly about, so I don't want to insult anybody, that's absolutely not my plan. But it puzzles me that if you choose not to vaccinate your child, and it gets sick, that you do go to the hospital with your child. So at point one, you don't trust healthcare, because we're saying vaccination is good, it's smart, it prevents your child getting sick. You know, I don't trust you. Then your child does get sick, and then you go to healthcare. So you do trust them. So I mean, make up your mind. And that, to me, as a rational man, that's very difficult to understand. But there are emotions behind that which are probably legitimate from the perspective of those people. But this is just one example and a high-profile example. But there are many of these examples in which we could do a much better job as part of society to create around us a setting of better health, more equity, that would help create a higher health standard for society. Yeah. So I guess it starts small with yourself. Yeah.
So, thank you for that. It was absolutely great. That's been. I'm going to let you go on and continue the heroic, historic, human battle against death and ill health. Thank you for that. That was great. Cheers.
Yeah.